So cortisone. Cortisone is it is a natural substance we have in our bodies, cortisol, cortisone, or some form of that. And it's made in our adrenal glands, which are right above our kidneys. So it's a normal hormone. It's a normal anti-inflammatory in our bodies. Now it's made artificially in factories and things like that nowadays. So the cortisone you get out of a bottle is not it's not natural. It's made and it's also chemically altered. It's not exactly the same cortisone that we have in our body necessarily. But and there's varying forms of it. But the bottom line is cortisone is an anti-inflammatory. So if you have inflammation, swelling, inflammation, it can decrease inflammation. It does a good job of that. That's the only upside in my mind. The downside is cortisone can damage tissues. You get one shot in your joint, it's not going to destroy all the cartilage in your joint, but there are plenty of studies that show that you get repeated cortisone injections. So patients, there's a couple studies just within, I think 2022, they came out, two specific studies. There's a bunch of other ones too. But in 2022, there were two studies that came out and they looked at patients who got cortisone injections in their knee versus patients who didn't. And the patients who got the cortisone injections in their knee, their arthritis actually progressed and developed faster than the people who didn't get the shots. So it's a temporary fix. You're kind of playing with fire because if you get too many of them, it's gonna damage your knee and make it worse. And so what you're trying to do is get your pain better and maybe it helps get the swelling and the pain better, but you're gonna have to pay the piper down the road because your cartilage is gonna wear down faster. Not to mention cortisone can increase blood sugar. If you're a diabetic, that can be a problem. It decreases healing. So if you get a cortisone shot in your knee, for instance, we don't like to do surgery if we don't have to anyway, but we don't like to do surgery for at least 6, 8 weeks after the cortisone shot because it increases the risk of infection. Who wants that? It also can damage the cartilage, like I said. It can also affect wound healing. And so if someone had a cortisone injection in their shoulder and then they had surgery, the wounds might not heal as well, but also the rotator cuff tendon might not heal down to the bone as well. And that can even be like in the shoulder with a rotator cuff. If someone gets a cortisone shot, they have a 25% chance more of not healing or re-tearing than if they didn't get a cortisone shot within a year. So it might be 11 months ago you got your cortisone shot, and now you have your rotator cuff surgery, and you're still at a higher risk of either not healing or failure, which is crazy. So cortisone has a lot of detrimental effects, and it's a band-aid, and it's not getting to the root problem.